Started. Thank you. All right, well, welcome everyone. Welcome to the October PFL webinar. As you probably noticed, I am not the usual face that you see talking on your screen. Joe is on the field, on the ground today with one of our clinics. So I will be walking through this month's program updates as well as our monthly resources. And we'll actually be hearing from Joe later on in the field. For today's webinar, we'll be introducing this month's monthly resources. We also have a guest speaker from one of our partners who will be joining us, and they have actually provided this month's operational resource. Just some quick housekeeping things. As always, this webinar will be recorded and shared out in case any of your colleagues couldn't join us. If you are able to, please stay on mute, and then we will call on you if you are a spotlight speaker. And then lastly, please use the chat. Megan is our DJ today, and Rose will be in the chat if you have any questions. So feel free to leave any comments along the way. But with that, we will go to our poll. So we went with a Halloween theme this month. And it looks like everyone's favorite candy is chocolate, so Reese's, followed by Twix. So we won't see you until after Halloween, so everyone have a happy holiday. But with that, we'll go on to the rest of the webinar. So as usual, this is our agenda for today. We will do a quick welcome. We have some project updates for you. We will walk you through this month's fundraising and operational resources, and then we have some updates for you towards the end. All right, so again, welcome everyone. A lot of the clinics on the call are veterans of Project Finish Line. We do have some new clinics who might be joining us today, so if you are, welcome. But before we get too far into the webinar, in case you didn't see, Project Finish Line was featured in CNN as well as one of our PFL clinics, El Milagro. And we were super excited to have this feature. So in case you haven't seen it, we are going to play it for you right now.
Tonight, despite the Texas governor taking steps to prevent vaccine mandates, one group in Texas is trying to win over vaccine skeptics. And this is what's so important for you to hear, they've actually been succeeding. Miguel Marquez is out front.
Zeferino Cantu considered getting vaccinated for months. Finally, he's taking the plunge. Now, more worried about the virus than vaccine side effects. The coronavirus is more dangerous, he says, because it can affect everything, even your mental capacity. The 63-year-old retired laborer is diabetic, has high blood pressure, and no health insurance. Getting the shot in his arm, not easy.
He would always tell me, I'll be back. I'll come back. I'm not ready.
And this was over how long?
I guess I talked to him about 3-4 months ago.
A familiar problem here at McAllen's El Milagro Clinic, vaccinating those needing it most. HHS estimates about half the unvaccinated are willing to get it, like 55-year-old horse race trainer Juan Manuel Salinas. I wanted to see the reaction of other people before I got it, he says. If they were okay, then I'd do it too. He was tough to convince, and his daughter works at the clinic.
He had all the resources, and I was like, do you need me to go pick you up? We do it for free here at the clinic. He's like, yeah, I'll go. So
and they never did.
Never did.
Her long effort finally paying off, and hope for more success ahead. El Milagro Clinic is now getting help from Project Finish Line.
What we hope to achieve is to get vaccine access to those that may be on the fence. I call them the unvaccinated but willing.
Project Finish Line now working with free and charitable clinics like Milagro in 16 states, providing money for pop-up vaccinations in rural places like Muniz, Texas. Phone lines for community outreach, even helping organize free rides provided by Uber.
We hear individuals who take the bus to and from work every day, and they cannot take a day off from work, and so they really need help with actually that transportation.
We missed part of the end, but give us a second and we'll try to pull it back up.
For those on the front line.
It gets to the point that staff thinks that they're sounding like a broken record. They will come around. There's a lot of people that are willing and just don't have the tools, the information, and the resources.
So look, the barriers to getting vaccinated for the most vulnerable may seem very low to you or me, but for them, it is very difficult to navigate. Project Finish Line says that it has helped put about 115,000 shots into arms since they started this summer. They hope to add more states and get to 1 million shots soon. Erin?
All right, Miguel, thank you very much. It's nice to hear a good story about this. Well, next, the number of Americans quitting their jobs has surged. It is at a record high. So why?
All right, thanks, Megan. So we are super excited to have gotten this feature and are really grateful for, I think, the long overdue recognition of all of the hard work the clinics are doing. So as always, huge shout out to Marisol and El Milagro, as well as all of the other clinics for this well-deserved recognition. If we go to the next slide, we have a couple of updates for you in terms of everything pandemic related. So as you'll see here, we're hitting mid-October. In terms of our daily trends, we're seeing cases go down and they're on the decline, which is really great. On the next slide, we will see a similar trend with deaths. So those are also on the decline. In terms of vaccinations, unfortunately, we are also seeing that these are on the decline. We've heard from many clinics across the network that it's become increasingly difficult to get vaccinations out the door, but every vaccination counts at this point in the pandemic. And so we just encourage you to keep pushing hard, stay resilient, and every shot at this point counts. One piece of interesting data that has been released recently from the CDC is they have this really great graphic now of showing your the likelihood of testing positive for COVID-19 as well as dying from COVID-19. So if you are vaccinated, or I'm sorry, if you're unvaccinated, you're at a 6 times greater risk for testing positive for COVID-19, and you're at 11 times higher chances of dying from COVID-19. And in terms of where we are in the pandemic, we are still in this phase 7, and of course, just pushing hard to get to the end of the finish line. In terms of interesting news as of last week, vaccine advisors to the FDA voted on recommending boosters for both the Moderna and Johnson & Johnson vaccines. The FDA advisory board last Thursday recommended booster doses for Moderna's vaccine after 6 months for people over 65 and for adults who are at high risk, either based off of their health or occupational exposure. That committee voted unanimously on Friday to recommend the booster, and as well for the Johnson & Johnson vaccine for anyone over the age of 18 and who got a dose at least 2 months ago. So in terms of what comes next, as far as this week, the FDA will now make a decision on those booster doses for both the Moderna and J&J vaccines. The CDC is actually scheduled to meet to discuss these boosters tomorrow, October 21st. So we will be keeping our ear to the ground to see what comes of that. The FDA is also working on Pfizer's request to authorize the vaccine for kids 5 to 11. Their plan is actually to convene on October 26th, and a decision could be expected to come as soon as after Halloween. And then, of course, the Pfizer boosters have been recommended for those 65 and older, as well as adults 18 to 64 at high risk, or those with high occupational exposure and risk as well. Looking a little bit farther into the horizon, the CDC for this holiday season is recommending everyone to get vaccinated, especially if any of your patients are traveling or are planning to be in big groups of family or friends. Health professionals are also recommending people to get the flu vaccine. Research has come out to show that it's safe to get the flu shot as well as the same time as the COVID vaccine. One recommendation if patients are a little bit hesitant is that they can actually get shots in different arms. And at most, they're most likely to experience soreness where the shot is given. And then lastly, another little tidbit is researchers are currently looking at to whether or not vaccines can be mixed. So for example, if you got Pfizer or Moderna, could you get a booster from one of the other vaccines? So far, it's preliminary research right now, but we will be keeping an eye out on this and we'll see how this unfolds. All right, so now to project updates. So far, we have raised our 520,000 out of our goal of 1 million. So we are over half of the way there. As a reminder, as funding comes in, you will either hear from us or your state lead, and we will be in touch for the distribution of those funds. And then for the month taking us through September, to date, the number of vaccinations our network has done is about 120,000. So those are really, really awesome. And we know at this point in the pandemic, each of those numbers count. So keep pushing. This is kind of our last big push until the end of the year, right before the holiday season. So keep these numbers going. All right, so now we are coming towards the end of our list of state leads, but today for this month, we will be having Mississippi as one of our first state leads. So if Asia, if you're there and can come off mute, we'd love to hear from you.
All right, thanks for that. Hi, everyone. My name is Asia McCoy, and I am one of the program managers from the Institute for the Advancement of Minority Health. Just a little bit of background on us. We are a local nonprofit headquartered in Jackson, Mississippi. We have about 6 robust programs that we oversee, ranging from COVID-19 all the way to HIV prevention. We were founded in 2019, and our mission is to reduce health disparities throughout the state of Mississippi. So since we have started our vaccine clinics, we have been able to vaccinate over 400 individuals, and we're really proud of that, and we're still growing. We have established about 10 robust partnerships so far, so that definitely has been something that we're very proud of. What we've noticed, especially with some challenges that we've been facing geared towards vaccine hesitancy, is that individuals are highly influenced by pop culture and just social media, particularly in our target demographic of 18 to 24-year-olds. So we are working to reduce the misinformation that is out there, predominantly through listening sessions. We've hosted about 7 listening sessions. We'll have our 8th one next Tuesday. But we are continually fighting the good fight to get as many people vaccinated as possible. And we actually just started an initiative to get the homeless population here in Jackson vaccinated. So we're working to get as many people access to the vaccine and to continue to fight that misinformation that is surrounding COVID-19.
Thank you, Asia. And in Mississippi, we have actually 1 clinic, our Jackson Free Clinic. But so happy that you can join us today, Asia, and thank you for telling us a little bit more about what's going on in your state. Next, we have Molly Stone from Alabama. Molly, if you're there, we'd love to hear from you.
Hello, I'm here. Yes, so we're just 1 state over in Alabama, and I am right now the board president of the Alabama Association of Free and Charitable Clinics. Our executive director, Dorsey Morrow, left us at the end of July, and so I am kind of trying to fill in with those responsibilities while we're still on the search for a new director. So, but I am also the director of Medical Outreach Ministries, which is one of the member clinics in Montgomery, Alabama. So we have 18 free clinics in our association, and I think 4 are members of the network with us here. So we're a relatively new association just in the last few years, and so we're still growing and all that. But some of the challenges that we faced is, as you know from the news, the southern states have gotten hit really hard the last several months. Delta really gave us a good punch at the end of July through really just through the last few weeks is when it's kind of started to let up. We had some of our highest case counts statewide in August, mid-August, early September. Hospitals were full. Lots of middle-aged people who had not gotten vaccinated were getting very sick, hospitalized, and dying. I personally know some people that happened to, or their family members. So it's been a rough few months. And so it's been a bit of an uphill climb getting people to take the vaccine because our state has had some major vaccine hesitancy. Right now, about 44% of the population of the state is fully vaccinated. But some counties are much, much lower than that. So there's still some work to be done. But our clinics in our association have done a good job of managing COVID exposure. They've all been able to remain in operation in some shape, form, or fashion. One clinic in the Birmingham area has done a lot of vaccines, has been running vaccine clinics for a lot of their surrounding community. And I think, over 1,000 vaccines there just in that clinic. That clinic's actually not part of this network, but anyway, just it's part of our association. But several of our clinics are providing testing and vaccines. We have had a great experience with working with Sustento and the network. With my clinic in particular, we did the survey with Joe and the other groups, the other folks from Sustento in partnership with BSRI. We started a survey on vaccine hesitancy in February and just wrapped it up in September. And they're evaluating all that data right now. But we ended up with more than 600 responses. And that has been really helpful in helping us to really pinpoint the barriers, the reasons for hesitancy. And we've been able to address those immediately as we got preliminary data along the way. So, for example, we had one of the things that popped up at the very beginning back in the spring was that people like cost was the highest barrier. And, we all thought, well, it's free. We thought everybody knew it was free. And so we hadn't really been saying that. Well, we started saying that, and then we could watch on the survey how when we provided that education, that barrier went down on the survey as it was just immediate feedback, like closing that loop and just getting a really good feedback from the survey. So we were able to do that in a timely fashion, and that really helped us be able to respond immediately to our patients' concerns. We were a stop last weekend on Joe's road trip, and he came here to our clinic, and we had an event, a community event, and we did we had about 75 people and did 25 shots that day. So we were excited about that because the events around town have been kind of low attendance in the last few months, just as we're kind of getting all those remaining people, but we had quite a few that were even getting their first shot on Friday. So we were excited about that. And we just think that the general publicity and everything that's gone on with Project Finish Line has really helped to raise the profile of free clinics nationally. And so we're just really pleased to have been part of it.
Thank you, Molly. I know we're so excited that Joe was able to see you in person, and he is on his roadshow right now. So thank you so much for sharing, Molly. And that's actually a perfect segue because next we are going to tell you a little bit more about that roadshow. So currently Joe and team is on the road. They are visiting 11 clinics in the network. They are doing community events everywhere from football game parties to other community events. There is local media covering the events. And we'll also be giving updates on our social media and sharing out kind of what those events have been like. But now we're actually going to hear from some of the clinics who will be either currently hosting events, have already hosted some of those community events. But first is Health Wagon. So if we have Dr. Tyson on the line.
Hi, I am Dr. I'm getting feedback. Is it still happening?
We hear you, Dr. Tyson, but there's a little bit of feedback.
There's a lot on my side. Let me see what I can. Let me go away from my computer here. Sorry.
Are you there, Dr. Tyson? If not, we can go next to Interfaith Dental and we'll come back to you in a second.
I think she was going to go to her computer. This is Rachel with the Health Wagon.
Hi, Rachel. Yeah, no worries. Why don't we hop over?
She was actually, I think she was on her phone and she had some problems with her video. So she was going to go to her computer.
Is that better now? Is that better?
Yes.
Okay. Yeah. I don't know what happened. My camera wasn't working earlier, and then I tried to just do it on my phone. So, but it must be getting some interference. So I apologize. But yes, we have I have been with the Health Wagon for over 28 years. We are the oldest free mobile clinic in the nation. A lot of people may have seen us on 60 Minutes about 4 years ago, but we have 3 stationary clinics, and then we've got the mobile health that we're most noted for. We are here in the far southwestern portion of Virginia, where our vaccination rates are incredibly low. They're hovering under 40%. The rest of Virginia has did very well, probably at about well over about 79%. However, here, in the far the mountains, the Appalachian Mountains here in the far southwestern portion of Virginia, we have, really critically low levels. So right now we've really had to underpin the public health system here in far southwest because, our public health departments, they do a phenomenal job, but they're just not enough boots on the ground to take care of what, ensued after the pandemic actually started. And so we have in large part become the public, had to undergird the public health system here. And so we have probably, and Rachel could probably give you exact numbers, but we've probably given we're probably closing on 4,000 vaccinations for our region. We have tested well in excess of probably 8,000 to 9,000. A lot of testing that we have did as well. And then we were the first in the region to offer the monoclonal antibodies. And we have give well over 200 of those. And those have been predominantly, we got those probably about 5 or 6 weeks ago. We're infusing at one clinic 25 and 30 a day that are in large portion of those have just not been vaccinated. So we see that as an opportunity, to encourage them to get the vaccine, because when they come down with COVID, they have a little bit of incentive there to get the vaccine. But we do have an event that's coming up, and what we're trying to focus this on is those that are 12 and older. So, we've got Halloween in the region. So we're doing a Hallelujah Harvest. We are a faith-based event where we'll do like the trunk or treat. We will do the trunk or treat in the region. And so we plan to have a lot of participants for that. We will give out probably, we're going to do one incentive as a cash prize of $1,000 of whoever gets, their vaccine that night. We're going to put those into like a pot and draw out numbers. And we've got some like Nintendo Switches and things that would, really appeal to like the youth. And so we do have that event planned. We're giving out, candy. We're also giving out Lucerna home test as well. Lucerna is a PCR that is highly accurate, probably like 99% accurate. So we're going to get a lot of testing out into the hands of the folks as well. We got these from the Virginia Department of Health, and we'll be giving those out as well because, people knowing whether they're positive or not is just critical for them to know. And so they'll have these home tests that they can actually take home that are highly accurate. And so we've been working with the state on that. as well. But that's kind of the event that, that we have coming up. We're advertising it like on our social media and, flyers out in the community and things like that. People really get, it's a rural area. People get really engaged, and things of that nature around, Halloween and so forth. And we are making it drive-through safe. With the trunk or treaters, they'll just kind of drive through an area that's in Dickinson County, which is the poorest county in the state of Virginia. And they'll just kind of drive through and, and receive the treats and that we have and the freebies that we have for the individuals, but also encouraging the parents to, allow them to go ahead and get their immunization if they're 12 and older.
Amazing. Thank you so much, Dr. Tyson. Rachel, was there anything you wanted to add?
Just looking forward to Joe's visit next week. He'll be with us on the 27th and 28th, and we've got a lot of good things planned. So looking forward to it. I appreciate your support.
Absolutely amazing. Thank you both. Next, we're going to hop over to Interfaith Dental with Holly.
Hi, everybody. I'm Holly Plemmons. I'm a senior program director at Interfaith Dental in Nashville. And Interfaith Dental is a volunteer-driven nonprofit dental charity that helps vulnerable populations. We have 2 sites, one in Nashville, Tennessee, and one in Murfreesboro, Tennessee. We were founded in 1994 and serve about a 10-county region in the Middle Tennessee area. So our staff and clinical volunteers provide oral health care to about 3,000 patients a year. And our mission here at Interfaith is really community-based, and it's to create a healthier community, by providing transformational oral health care for those experiencing poverty. So since the vaccinations have been available, we have been doing a lot of work patient by patient using motivational interviewing to address hesitancy that we encounter on a one-by-one basis. And we've been able to make some connections and referrals and provide a lot of support along the way. But we're very excited for our vaccination event, which is happening next Thursday, so October 28th, starting at 3:30 p.m. at our Nashville clinic. We've called it Shots and Smiles. So we're really excited to get that going. We are partnering with a local federally qualified health center, Matthew Walker Comprehensive Health Center. They're sending some folks over to actually administer the vaccines here on site. We've shared the information with our community connections as well. So what we have planned for that is to have folks come in. They have pre-registered with us. They'll be able to receive their vaccine. Matthew Walker is able to administer the Moderna vaccine, so it's for ages 18 and up at this point. As an incentive, we're offering a $500 voucher for care. So if you were a patient of record, you got notice of that first. We sent it out via our email and text services to let all of our patient base know that if they needed a vaccine, they could come and get it and they would receive $500 in care. If they were already vaccinated, but they would bring a buddy, both themselves and the buddy each would get a $500 voucher for care. And then once we had plenty of time for our patient base to kind of respond to that information, we've then opened it up to some of our community partners and medical clinics. So we've gotten some interest, gotten some appointments scheduled. So we're pretty excited to see how the event goes. Everyone who comes in will be able to meet with a community dental health coordinator who can help connect them if they have any additional needs or questions, get an oral health care kit. So lots of work going on to prepare for that. And we are excited to see Joe and team tomorrow on the road trip here at Interfaith. So we're looking forward to being able to visit with him.
Wonderful. Thank you, Holly.
Thanks.
And then lastly, we're going to stay in Tennessee, but we're going to go over to Sabrina at Helping Hands.
Hello, everyone. I'm Sabrina Blue, the CEO and founder of Helping Hands of Tennessee, and I'm blessed because I have Joe here with me right now. Live, along with TCCN is visiting us today. And so we got a chance to welcome them in. First, I'll tell you about their experience so far. They got a chance to, Joe walked right in the door with the press. So we had Councilman Ernest Brooks here. We had our vice mayor that visited and to shake hands with him and welcome him into the community and to let him know how valuable the services that we're providing for our community is for Jacksonians. So we had a local newspaper and WBBJ TV station here to welcome him in. And so he got to work right away. I mean, he didn't even have time to put down his book bag. It was amazing. So, and we are a nonprofit 501c3 organization that provides sliding scale discounts for low-income populations. We've had our dental clinic for 4 years now, and it's a full general dentistry services, including a dental lab. We just recently launched our medical clinic, but we've been engaged with COVID education, to COVID testing, to COVID vaccination. And most of our events have happened actually outside of our building. Our outreach is really heavily involved into the church communities because we see, a major deficit there. There's a lot more work to do as more churches are wanting to engage and have us there at their part of their congregation. And so we're excited about, what this means for the future for Helping Hands and really being engaged inside with outreach communities. And we're happy to have Joe here with us to hang out. It's been a great experience. He's got a chance to tour the facility, kind of see where we're at and where we're going. We have a lot of programs that we'll be launching and some great partnerships, and he got a chance to be a part of that experience here today.
Awesome. Thank you so much, Sabrina. And major kudos again to all of the clinics. Not all of the clinics on the roadshow were able to speak today. Hopefully we'll have some of them join us next month. But best of luck with the event if it has not happened so far. And thank you all for sharing for how that's been going. We are now going to take our 5-minute break. We are going to throw in the chat the survey link for your September report if you have not completed it yet. So feel free, get a bite to eat, fill out the survey. If you have any questions, we'll be in the chat. But Megan will outro us with a little bit of Halloween music, and we'll see you all in 5 minutes. All right, welcome back, everyone. Megan, if you're there, we will next go over to our fundraising and operational resources for this month. So for the first one, I'm actually going to hand it over to Megan to introduce this month's resource.
All right. Yeah, so hi, everyone. So we decided that, as you are working on fundraising and trying to collect donations, it's very important to understand the best way in which you can translate donations and money into impact for your donors to understand. So to do this, we thought it would be really helpful to create a simple but really effective template that can be used to help translate some of this, jargon and understand, just to better understand, the translation. So we hope that you are able to take a look at this, and hopefully it'll help simplify some of your fundraising efforts. And if you have any questions, you could always email us or ask us, and we're happy to help.
Perfect, thanks, Megan. And I will also add the one-pager or resource that you see on the right-hand side. That will all be editable. So you will be receiving a link to a Google Slides document. You can download it, input some of your clinic information, and then you'll see on the right-hand side, there's different levels. So you can get creative with this. You can say, for example, if you donate $100, this will result in X. Perhaps so many appointments or some of the supplies that you need. So you can tailor this and send it out in your fundraising efforts. But if you have any questions, please feel free to direct them to me or Megan. But we're happy to provide this one as your fundraising resource for this month. All right, so for our operational resource this month, we are actually collaborating with one of our Project Finish Line partners, Stronger. You might recognize their name from the Project Finish Line Toolkit. They have contributed a lot of our social media posts for Facebook and Instagram. And so if you go to the next slide, we give you a little bit of a preview of one of their social media posts. But in this month's resource, it's like a mini toolkit. So There are social media posts. There is an advocacy letter if you want to advocate for school mask mandates. There are also some additional resources that we are providing. For example, there are general fact sheets about COVID and the vaccine. Those are provided in multiple languages. There's also conversation guides that the staff in your clinic can use. And there are also Q&A videos with a pediatrician, as well as more. But we actually have Stronger with us today. So we are going to hand it over to them and they will tell us a little bit about their organization and the work that they do. I believe Joe from Stronger is joining us today. Are you there, Joe?
Hey, yep. Sorry about the lag. Can you hear and see me okay?
Yep, we
Great.
can.
Well, it's nice to be here with you all today. I've been able to listen in to the agenda. You're doing great work. It's great to see. It's nice to see some success stories. We're Stronger is a campaign that yeah there's two Joes. I don't know if that's allowed actually. But nevertheless, we are here. It's supposedly a common name, but it's actually really rare that I run into another one. So Stronger is a campaign that we've been running for a little over a year now, I guess about a year and a half. It reaches about 1 million people a week. So it's a good size campaign. It's got social media accounts and some local partners. We work with most state vaccine coalitions. So they get some technical assistance and some trainings and then some materials. We work with a lot of media outlets, as you would imagine, and then a whole bunch of social media influencers and different partners like that help get the messaging out. So it definitely has what I would call an integrated marketing campaign behind it. And the purpose is to promote vaccination and simultaneously to fight misinformation about vaccines. It's very pro-science. It's very advocacy feeling if you go take a look at it. And it's changed a lot since the beginning. We started it before most people had even heard the term misinformation. And when in our polling, almost no one cared at all about vaccine misinformation. We did audience testing when we first started, and even among people who self-reported that they really cared about science or they were really pro-vaccine or like they followed the CDC on Facebook, a really, really small percentage of them were interested at all in following a campaign like ours or getting additional information about vaccine misinformation. And a lot of people reported that they hadn't seen any. And now, of course, fast forward to where we are now, and it's a term just about everybody has heard, and we all feel like we see vaccine misinformation somewhere. So I have a little bit of a presentation I can walk you through just to share some information about some of the materials that we've produced for kids getting back in school, and a little bit of the learnings that we have around messaging. But I'll just start by saying I think that there's a lot of expertise on this call today. So I wouldn't expect that everything I'm going to say is going to be new information to all of you, but hopefully you'll find some information in here that's new or that's helpful or useful. And I'll move along pretty quick because I just want to make sure that there's time for conversation and questions. This isn't meant to be a lecture. My own background, if you haven't seen me before, if this is the first time we're talking, my background's in public health, so I'm not a medical doctor, I'm a doctor of public health. And I've been at PGP, or Public Good Projects, for about 6 years. It's existed since 2012. It's a public health nonprofit, and it only works on public health programs. So we work really, really closely with different agencies and HHS and different hospital systems, and we're pretty well integrated into the healthcare system in the US. Our biggest partner outside the US is UNICEF. So we are UNICEF's partner in global vaccination for kids. and we're their only partner when it comes to combating vaccine misinformation in all the countries that UNICEF works in. So we're in a whole bunch of countries outside the US. So we're part of the Vaccine Demand Hub with USAID and WHO and some of those groups, Gavi. So if any of that is helpful, or if you have any questions about any of that work too, I'm happy to answer those. But I'll go ahead and share my screen here. I think I have permission to do that. We'll see. Can everybody see the screen okay? Okay, great.
Yep, looks good.
So some of our partners there on the right-hand side of the slide. This is our SHOT. If you're not familiar with them, so I know some of you are physicians. This is our SHOT, is the largest network of physicians and basically healthcare providers active on social media. So they all come together. There's a website. There's alerts that go out through this network, and they use the influence that they have and the expertise that they have to give people information about vaccines and to write the record when it comes to information about vaccines. They're really, really active. There's about 1,500 physicians within the United States that are part of this. And Vacunate Ya is the Spanish language version of that. So there's about 100 Spanish-speaking physicians that are part of that, and they're also very active. Shots Heard is behind the scenes helping healthcare providers who are attacked online by anti-vaxxers or conspiracy theorists or whoever. It's kind of a little online army to give people resources when that's occurring. Project Vector is the largest effort in the US to track vaccine misinformation. It was active before the pandemic, and it's ballooned, really significantly since then. That's the engine that actually operates behind the scenes with Stronger. So that's how Stronger identifies what it's going to talk about is Project Vector. It's password protected, but any of you can get access. So if you want access, just let me know after the talk and we'll give you access. It's projectvector.com. And once you pop in your password, you can see a whole bunch of information about vaccine misinformation circulating in different regions of the US. That was scaled up globally for the Vaccination Demand Observatory, which is a UNICEF-run program that we run in partnership with them. And that's in a whole bunch of countries, but the same concept. Stronger is the campaign we're talking about right now. And then we work with a lot of community organizations. So it's really great to see all your groups here today. I don't know if any of you work with Direct Relief International, but that's where I used to work. So they're a great organization, and I got to work with a lot of clinics in my previous career. So I'm very familiar with the great work you all do. And there's some other initiatives funded by Rockefeller and other groups that work with a bunch of community organizations, and we're the backbone support organization for those. So we have numerous ways to assist. Stronger, like I mentioned, I won't spend too much time on this slide. You can go to the website if you'd like, or if you don't currently follow it. And again, I think it's just every part of this pandemic feels like we're building the plane while we're flying it. And I would say Stronger is no exception. So there's stuff that we really thought was going to work, and it has fallen completely flat. And there is stuff that we just created as filler content. We thought it might work, or we just needed to check a box, and it's done better than anything else that we ever built. So there's a lot of learnings there, and I feel like that's happening all the time, every day. And some of those learnings I can share today. So one of them is pandemics are unpredictable, and that's part of the challenge, of course, with messaging, is that the perception, if you're not in healthcare or public health, is that we don't know what we're doing because our message changes so often. And some of that's true. There have been bungles along the way. But of course, the real reason is things have changed really rapidly. The dynamics changed a lot. And the politicization of the pandemic is the biggest challenge as we see it right now. There are very much two different United States at the moment. There are very much two distinct groups of people that get their information from entirely different places. And that's a huge challenge that has not existed before in my lifetime in public health. So it took an already really complicated situation and made it really, really complicated. on top of, all the reasons it was going to be complicated initially. You can see some of those reasons here. Just the US has a federalized healthcare system and public health system, which means every city and county and state is a little bit different than its neighbor. So it makes responding to a pandemic extra challenging. When we see vaccine opposition, which isn't most people are not an anti-vaxxer. But the reason we think anti-vaxxers are important to pay attention to is there is a very well-funded, very highly coordinated group of people and organizations that are responsible for most of the vaccine misinformation that we see circulating in communities. So a community member is not necessarily an anti-vaxxer, but when they come to you and they express a concern, the reason that they have that concern often, not all the time, but often, is they have heard something in the ether that originated from a vaccine opposition group. That was equally true when in 2019, that quaint time, the before times before this pandemic, when we had measles outbreaks popping up all over the US. When researchers went in and looked at what was driving those measles outbreaks in New York City and California and Minneapolis, the talking points that got into those communities were anti-vaccine talking points that were created by anti-vaccine organizations targeting those communities. And then they got legs of their own and became part of the narrative that people couldn't tell you where they heard it. But common motivators, money, always is a big one in everything, but it's a big one here too. Eyeballs are important, and eyeballs also equal power. There is a real incentive to polarize, and there's a real incentive to politicize. So people's whole political careers now are based on being an anti-vaccine advocate or an anti-government or an anti-public health advocate. That again is pretty new. Repeat tactics. So you'll see this, and I'm sure those of you who are on the clinical side see this yourselves every day. Cherry picking data, so either deliberately misinterpreting scientific data or you're not trained to interpret it, and so you're reading something and you feel like you understand it. There's a sentence in there that you latch onto, and it's part of a story, and you don't understand the whole story. You look at one tree and you miss the forest, either intentionally or unintentionally. A bunch of fake experts out there, just a tsunami of people with make-believe credentials and make-believe facts. Race baiting is a new one. So most anti-vaxxers in the US are white, and they were really easy to identify before. They were either really liberal or really conservative before the pandemic hit. Not so anymore. It's changed a bit, but because the most famous anti-vaxxers and anti-government people in the US are still white, and they tend to be, most of them tend to be conservative, they are going to where their message is, they're getting a reception to the message, and they're paying attention to what public health people say in terms of where vaccine hesitancy exists, and they deploy their resources to those places. So we see this over and over again, is when public health people started talking about, for example, communities of color have high vaccine hesitancy, what we were talking about months ago. What we saw was anti-vaccine groups starting bus tours and speaking tours in those communities. So they're paying attention, and they're very good at mobilizing quickly. And basically the line is, public health and the government have never been your friend. There's example after example of systemic racism and overt racism against your community. Why would you ever trust them now? And that line can really work, especially if there isn't a robust community health infrastructure already in place, and that trust that's already been built in place. And there are really, really good reasons why communities don't trust public health and healthcare. And that can be leveraged for nefarious purposes. And we're seeing it all the time. Bullying, that's new to, there's a lot of people in public health and healthcare that have never been ever had somebody spit in their face before, or call them a name, or post their home address online. And now that's happening every day, and we're just not used to that. Politicians are very used to that. So there's lessons we can learn from local politicians. And then latching on to popular issues. They are, the stuff that resonates the best with people is stuff that feels local and personal. So basically anything that's moderately interesting, if you can attach it to your message, it's more likely to resonate. There doesn't need to be a logical connection between the two. And so that's really, that's down to a science. And the other side is much better at that. They tend to be much better at that than us. Recurring themes, I won't go through all of these, but I don't imagine these themes are new to any of you on the call today. But these are things we see over and over and over again. And what I mean by themes is, there might be 5 represented here. They collectively represent millions of individual instances of misunderstandings and rumors and myths, misinformation that all ladder up to these 5 themes. So personal freedoms, there's a whole cascade of talking points around personal freedoms. And then the types of key players, this has evolved a lot. Anti-vaxxers used to be easy to find, and their main thing used to be, vaccines cause autism. It was a talking point we hear all the time, and they're not safe. And it was kind of the same 3 talking points over and over again. Mercury, those sorts of things. And now it's much more sophisticated. There's a much bigger playbook, much more sophisticated strategies going on behind the scenes. And groups that never talked to each other before are now going to the same meetings. They're on the same email listservs, they're attending the same rallies, they're joining the same Facebook groups. And those include foreign actors, Russia and China and other groups. Although that is the least of our concern, most of this is homegrown. So there are Ku Klux Klan members, there are white supremacists, there are militia members, there are conspiracy theory groups, and they're all joining together with your old-fashioned anti-vaxxer who might still believe that vaccines cause autism. So it's just a different landscape than it used to be. And if you feel overwhelmed and exhausted and confused by all this, you are not alone. It is very complicated and very challenging, and no one has this all figured out. So terms to know. I won't read these out loud, but just remember, if you're in this space and it seems daunting, that public health and healthcare have only been dealing with this for 1.5 years in any kind of meaningful way. So there is a lot that we have learned very quickly, and I'm very proud of our 2 fields and what we've been able to put together very quickly. And there's a lot more to do to do this work better, and I think we all understand that. We all recognize that. And there are other fields that have really deep expertise that we can pull from. Public relations, people in crisis communications, people who study propaganda, people who study terrorism. There's really deep knowledge there that we can pull from to fill in some of the gaps in our own knowledge. For example, you do not need to respond to every piece of misinformation that you see. It's worthless, it's irrelevant, and it probably will make the situation worse. But in the beginning, people in public health really, really strongly believed that we have to respond to every single thing that we see. You were hearing that a lot. So what can we do about it? This sounds so simple, but I still see examples every day where we miss the mark as a group, as public health. We forget often to be personal and empathetic. And I think clinicians and people who work in the types of environments that you all work, you're the last people to forget this often. But nevertheless, it is common to see it. Facts matter, but the delivery of the facts matter a lot more. And one time talking to someone will not convince someone of anything. You can be Tony Robbins, you can be Martin Luther King Jr. You need to speak more than once to make anything happen. And so what we're seeing is it's the 15th time that you've talked to the person that often they might make a decision. They might change their behavior or think about something a little bit differently. It's not usually the first time. And if you can be personal and empathetic 15 times in a row, every time you see that person, that's a winning combination. Listening, active listening, things that clinicians learn, good clinicians learn and practice in their practice. Validating of someone's concerns. Yes, facts are important, and you should know your talking points, and you should know what the science says in this moment. But again, if that's not linked to a personal experience and there's not a face attached to it, and that face doesn't reflect doesn't understand the needs of the community, and often isn't from that community and understand where people are coming from, it's going to have no effect. People don't need trifold brochures about this stuff. Account for differing experiences. And then on the right-hand side, you see the don'ts. We all see examples of this all the time. So I'm not assuming any of this is new to any of you, but good luck not getting political in today's environment. But you're gonna hear people talk to you, and it's gonna be really, really political. And your job now is to attempt to pretend like it isn't, to try and find the middle ground. And I think my prediction is we're going to continue to evolve there as professionals. Right now, we continue to stick to, I will not be political while I'm talking to you. I feel like that is going to change in the future. We're going to have to figure out some way to meet people where they're at, because we can't pretend it isn't political. We can't pretend that your party is not hugely correlated with your intent to vaccinate. It is now. And how do we do that in an honest way? How do we have that conversation in an honest way, in a non-judgmental way? Don't repeat misinformation if you can help it. Don't take it personally. It's almost impossible. Try not to. We all have to figure out our ways to sleep at night, because a lot of these attacks are very personal, and it's hard not to take it personal when you tell someone you're an expert or you're a clinician or you understand. You're trying to help them, you're trying to give them good information. They say they don't trust you, or you don't know your facts as well as they do because they did 15 minutes of Googling. Don't vilify the sharer. That can be hard too when the person's being really nasty, really mean to you. But that's the job. And then don't rely on fear. This was the mainstay. Everybody really believed this in health communications. This was written in stone. This came in a tablet off of a mountaintop. Don't rely on fear. But now we're seeing things change really quickly. So there are health communication campaigns or vaccination demand campaigns out there all over the US that are relying on fear. And people are testing this and they're seeing if it works. It's not the only space where we've done this in public health. Tobacco control campaigns use fear all the time, really, really effectively. So people are dipping their toe into this space and they're saying, well, maybe under certain circumstances, we can actually use a fear-based message for COVID-19 and for vaccines. But it's new territory and there's going to be a lot of mistakes made because it is new. There's 3 ways to, how am I doing on time, by the way? I want to make sure I don't go over.
You're doing perfect. No rush.
Okay. Generally speaking, if you talk to experts in vaccine misinformation, there's kind of 3 buckets of how to respond to this stuff. So there's debunking, which most people are now familiar with, which is you're responding to misinformation. There is a science around how to do that. But generally speaking, you combat bad information with good information. The evolving knowledge here is, like I said earlier, it isn't important or necessary or helpful to respond to every instance of misinformation, to every misunderstanding. There are now frameworks, decision-making frameworks that exist for people who are an infodemic manager, for people who are responsible for communicating to the public or stakeholders. And does it rise to the level of concern where I need to do something about it? And that is a level of sophistication that is very new to our field. And it will continue to evolve. And these frameworks exist, and I can share some of them with you if anyone on this call is interested. They're not in this presentation, but just let me know over an email and I can send you some. And then in that rebuttal, we used to say in public health, provide evidence, but now that matters not so much anymore because your evidence is, they have their own evidence. And so it's just a battle of who yells the loudest with their evidence. So it's still important to have truth on your side and the facts on your side. That will always be important. But what really matters a lot, if you can do it, are personal stories. So a lot of why vaccine misinformation is sticky is because there's a face attached to it. There's emotion, there's a person attached to it. And a lot of why public health and healthcare's messaging isn't sticky is there is no face and there's no emotion and there's no personal story attached to it. It's just a fact. And for a really, really long time, we were told that that was important to maintain and that was the best way to do this work. That is obviously not true. So it's really important to have the trifold brochure and to have the talking points and to know your facts. But it's increasingly understood that you need a person and you need a community member and you need a community leader. The messenger matters more. Inoculation theory is really new. And what this means is it's stolen from immunization, that word. But what it means is, you've seen enough misinformation to know what's coming, the sort of narratives you're going to hear again and again and again. And so you create some talking points and some communication materials that pre-bunk, that inoculate the people that you're meant to serve against what you know they're going to hear, what they're going to encounter. And I'll show you some examples of that. It's, like I said, it's very new. A lot of people are uncomfortable doing this, but it's easier than debunking because you just need to figure out, all right, well, I'm going to hear these 5 kinds of themes over and over again. Here's what I'm going to say when I hear it, rather than what do I say when I'm confronted with a new thing every 30 seconds. And there are good studies that show if people see truth before they see fiction, they're less likely to believe in the fiction. So there's some good evidence supporting this approach. And then what we tell people to do, and I completely understand if you want a different approach here, and it is not a silver bullet. There's a lot that needs to be done, but on the digital side of things, on the social media side, every platform has a way to report misinformation and to report accounts that are spreading misinformation, and almost no one does it. So we try and encourage people to do it because we work with all the companies, all the ones that you would know that I won't say out loud, the ones that are often speaking in front of Congress. And it is difficult to hold them accountable in every way that they need to be, because they have their own data to show that you in public health tell us that this is important and that we should flag misinformation, et cetera. But also you in public health don't flag misinformation yourselves. We have almost no one doing that for us. We've made the tools and no one is using them. So I think it's important that we hold up our side of the bargain, our side of the conversation, and encourage people to be digitally literate and health literate as well. And I think that's part of it these days. I am personally a big believer in holding the social media companies accountable, by the way. But I do think that there's some onus on us as citizens that we have a job here too. Debunking examples from Stronger. This is some of the material we've put out. I won't read you each one of these. You have this presentation, but it can kind of be a difficult thing to wrap your head around in the beginning. But once you do this a few times, it becomes really easy. And it becomes a thing you can replicate over and over and over again. You don't need to be an expert in propaganda to get this right. It doesn't need to look a certain way or sound a certain way. It's more about doing it. So just some examples of what we've done before. And again, this comes from, we knew people were going to be seeing misinformation about these topics, so we preemptively released this material. Inoculation messaging, again, so we knew this was coming, we made these messages. the shedding thing is everywhere and it's not going away. I could not have predicted it. It's weird. It is mind-boggling, but I now see it everywhere in every corner of the internet, in schools all over the US. People are really latching onto this. And it's because it sort of sounds like it could be true if you don't know what you're talking about. And also you hear it over and over and over again. Repetition matters. So what studies have shown is that even if you know what the truth is, if I just bombard you with my falsehood again and again and again, eventually I will convince you that there must be some element of truth to what I'm saying. Otherwise, I wouldn't be repeating it over and over and over again. And the other side knows this, and they use this. This is, by the way, why fact checkers work in shifts. If you put someone, so we have fact checkers who work in our organization. These are people who have master's degrees in public health. We have people who have advanced degrees in laboratory science. If you put someone like that in charge of identifying vaccine misinformation and conspiracy theories 8 hours a day, 5 days a week, they will become an anti-vaxxer. No one is immune to this. So you have to limit your exposure to this stuff, because you will start being sucked through the looking glass into this make-believe world, and you will start thinking that there's some credibility to what you're seeing. And anyone is vulnerable to that. So I thought I would share that anecdote because a lot of people assume that if I just know enough, I won't. This else is just so ridiculous, but it's not true. So we don't let our people work on this stuff for more than a couple hours a day, and then they move on to other projects. Back to school. So there are some resources that we've built for kids and for parents and schools. There's a lot more that's out there. I'm not saying only use what we created. We have a blog that has some good resources in it. We have a newsletter that anyone can sign up for that sends out resources once a week. And it's not just our resources. What we try and do is we try and find resources that are great, that anyone has created, and share them. And so if any of you know of resources, I would be more than happy to include it in the newsletter and on our website. We would love to do that. But you can see what some of the resources look like here. My mother is a retired school district superintendent. So everyone in my family has been a teacher at some point or another, including myself. So this is close to home for me, and I very much understand the sensitivities around this and the pressure to do it right. The pressure that school administrators and teachers are feeling right now. Additional resources, I just put these up. These are links, so these link out to some of the resources. And again, you'll all have this if you don't already. And we're just trying to do our best to curate all these resources together. We're in regular meetings with the White House task force, as well as a number of other organizations. And those are Zoom calls just like this is a Zoom call, and it's just a bunch of organizations putting up their resources in the Zoom chat, and we all take it and try and do what we can with it. So that's what everybody's doing these days. There's no better way to do it. So we're doing what you all are doing. And that's it. So I hope I ended up with enough time for at least a little bit of a conversation.
Yes, absolutely. Thank you so much, Joe. This has been fascinating. We are kind of running close to time, but if any clinics have any questions, let's take 1 or 2 minutes. If not, we can also throw them in the chat. But if any clinics have any questions, please feel free to jump on.
This is Sarah from southeastern Wisconsin. And Joe, every time we're on the Sacento meeting, this is like exactly timely and perfect. So I have my master's in public health, and for 20 years has been in public health, and it broke my heart reading the New York Times saying that there's this mass exodus of public health workers and how crippling the rest of the country is going to be without strong public health workers. And so just thank you for doing what you're doing, and Sacento for connecting us in the free clinic worlds to what you're doing, because we need to be better armed. And you're right, it is very easy to get sucked in to all the negativity. So I want to applaud you and say thanks.
Thank you. I really appreciate you saying that.
we have any other questions? All right, if any clinics have any questions, please put them in the chat. I see Arman. Are you there?
Yeah, says hi, Joe. That's an eye opener. Thank you so much again for so much of information. Very, very beneficial. Is there any kind of a information posted somewhere which could help us in helping some of these questions which come up from the anti-vaxxers or people who are hesitant, or any kind of an area where you could direct us to where we could go and read the most recent information? You know, DHS has some very generic information which is out there, but some of those particular points which you raised, is there anything which you have in your presentation which we could have a copy for, or anything which you could direct us to?
I think the answer is yes, but just so I fully understand and I direct you in the right direction, are you looking for most common misinformation, or are you looking for helpful ways to have the conversation to address the misinformation?
Both.
Okay. Yes, there are some resources that we use ourselves that I think are great. And so I think you see, yeah, so Madeline's email is there on this slide that you can see on your screen right now. So
Yes.
She runs all outreach for Stronger. That email will go directly to me and my staff. So we really do check emails and respond as quickly as we can. So just, if you don't mind, just send your request to that and we'll pull some resources, and I'm very happy to send them back.
Absolutely. I want to take a quick picture of this so that I can remember this email.
Yeah, it's kind of long, sorry.
Yeah, perfect. No, I got it. I got it. No, thank you much again. I appreciate it.
All right. Thank you so much, Joe. And I know Maddie, who is also on this call. We've heard from clinics, the resources we've been able to include in our Product Finish Line Toolkit have been widely used and greatly appreciated. The conversation today was just fascinating, and I think we could go on for hours about it. But so happy that this is timely for our clinics. We've been hearing a lot about the hesitancies and just, trying to equip them with strategies to combat it. So much appreciated. I see Maddie has put the website and her email in the chat. Please feel free to connect directly. If not, feel free to reach out to me and I will make that connection as well if anyone has any questions. But thank you again, Joe, and your team for joining us today.
Thanks a lot for having us.
Perfect. And let's see, if I could request you to stop sharing your screen, Megan will give us a couple more updates and then we will conclude today's webinar. All right, so we'll make sure everyone has a copy of the slides and has access to this month's resources. A quick couple of updates just from our team. We'll go to the next slide. Next month is actually going to be our last webinar. So our last webinar will be in November. Everything else is going to stay the same. Every month we'll be giving you tools and resources. We'll still be hosting our weekly Sustento support hours. We also request that you continue to submit your monthly reports. The Facebook group is still active. The only thing that we are phasing out are the webinars. So we'll continue to offer all of the resources and the programming from December to February. And our hopes and sights for the end of the finish line will be in March. So again, next month will be the last webinar. Everything program related and the support will continue until next year. A request that we got from one of our partners, they have donations available for hand sanitizer. So if you or your clinic is interested in receiving any of those donations, please send me a message. We'll get your name on the list and we'll reach out to any clinics that are interested in receiving that donation. A quick reminders of what's coming next. If you haven't submitted your September report, please do so as soon as possible. We hope to receive them by the end of the day. Again, we'll include our link to our support hours in the webinar deck. If you have any questions about the resources that we're providing this month or anything else, please be in touch. And then lastly, please mark your calendars for our next webinar. Our final one will be on Wednesday 17th at 1 p.m. Eastern. We'll be following up with an email just recapping today's webinar, as well as a recording and some of those reminders. But as always, please feel free to reach out if you have any questions in the meantime. But we'll end 5 minutes early, give you 5 minutes back. But thank you all so much for joining, and we will see you next time. Megan will play us some outro music. We'll stick around if anyone has any questions, but we will be in the chat.
Megan, I was going to stay on just so I had a quick verbal